Lupus or systemic lupus erythematosus is an autoimmune disorder.
Autoimmune disorders occur when the body's natural defenses against harmful foreign invaders and disease begin to attack itself.
It can take years for lupus diagnosis to be made. This disorder is difficult to diagnose largely because the lupus symptoms can mimic those of other diseases and cause complications and inflammations throughout the entire human body.
Lupus is famously known for its butterfly rash or its malar rash.
Malar rash is a red, scaly rash covering the cheeks and bridge of the nose. Malar rash occurs in about half of lupus patients.
There's no single cause of lupus, however, there are a number of factors that may increase your risk. It is important to note that the treatment options for lupus vary and should be tailored to the patient's specific signs and symptoms. Treatment also depends on the organ systems affected and the severity of the disease.
Mild forms of lupus may be treated with non-steroidal anti-inflammatory drugs. NSAIDs are available over the counter and include naproxen sodium, Aleve, ibuprofen, and Motrin.
These are used to treat the pain, swelling, and inflammation and fever associated with lupus.
Also, learning how to manage your stress levels and mental health by seeing a therapist.
Just like any diagnosis, it's essential to understand that the disease does not define you. It's what you have, not who you are.
Lupus is what you have, not who you are.
Lupus is what you have, not who you are.
Patients with more severe life-threatening complications will require more potent drug remedies, including steroids, immunosuppressant drugs, dialysis, and sometimes even organ transplants.
Seeing your doctor and staying up to date with your current health, getting enough sleep, limiting time in the sun, regular exercise, and eating a healthy diet.
Surround yourself with friends, family, and supportive people. Learn as much as you can about the disease. Knowledge is power.
Learn to incorporate new coping mechanisms into your life, such as meditation, art therapy, writing, yoga, and other stress-relieving practices.
The majority of people with lupus, about 89%, live a normal, healthy, and happy life.
Hey guys, I'm currently at the doctor's and I am interviewing a registered nurse. Her name is Tammy. She's going to tell me a little bit about lupus. Hi Tammy, what kind of doctor manages lupus patients?
Usually lupus is managed by a rheumatologist.
What exactly causes lupus?
Mainly lupus is a genetic disease, but also environmental factors can also play a role.
When I was doing my research, I found that about 90% of lupus patients are women. Why is that?
I believe, and I think there's more research being done on this, but it's true, women are more affected by lupus, and it's possible that the hormones, women's hormones, may play a role in that, especially estrogen, because after menopause, the ratio of women having it more than men kind of drops. So
interesting.
Yeah.
Have you personally ever seen any really young children with lupus?
I have not, and I'm really not aware. I'm sure there may be a few cases, but I think it's typically once your endocrine system matures and hormones are more developed and excreted that lupus develops.
Do you know anyone personally with lupus?
I did have a coworker that had lupus, and she did very well. Thing with lupus is you do want to make sure that you do follow up with your medical provider and keep regular scheduled appointments and be compliant in your medication regimen that they recommend for you.
And what is your advice for patients with lupus? What's the biggest?
The biggest thing is to make sure that you do stay in good communication with your medical provider for them to assist you in dealing with the disease.
What are common medications prescribed or given to lupus patients?
For mild cases, just an anti-inflammatory such as an NSAID or possibly acetaminophen. For more severe cases, anti-inflammatory such as prednisone may be prescribed. Also, immunosuppressive drugs may need to be used.
Okay.
When someone has lupus, they have periods of remission and flares. Remissions usually feel like lupus is gone, but in reality it's just dormant in the body.
Some people can tell when a flare is coming when they begin to feel more lethargic than usual. The fatigue can stop you dead in your tracks and can last anywhere from a few hours to a few days. Some patients report curling up in bed and feeling like they have the flu. Fatigue feels like a heavy stack of metal sheets stacked on your chest. Lupus patient reported that she had to spend days wrapped in ice packs. She reported that it hurts to sit, it hurts to stand, it hurts to walk, it hurts to sleep, it hurts to breathe, and it hurts to live. Another patient reported, it feels like I just ran a marathon, however I've been sitting all day. On an online lupus blog, I found lupus patients hear this statement a lot. You don't look sick, but lupus is oftentimes a look good, feel bad disease. Thanks for watching. Bye.
My
And
bad.
then you can read the back.
Autoimmune disorders occur when the body... Wait, what was it? Bodies. Autoimmune disorders occur when the body's not...
Sorry.
Rash or meta rash. I was laughing because I clicked the stop after you were just like,
That's what's hilarious. Because I was like little bits of hand rub. You're just like waiting for the camera to turn off. You're like, eh. Wait, so what do I say?
Lupus is not who you are.
No,
Lupus is what you have,
All right.
not who you are. Some patients report throwing up in bed and feel like they have the flu, fatigue.
Think?
Is it recording?
No?
It's recording.
One online blog that I read on an online blog I found one woman reported feeling that like no matter how hard she tried, I just cannot get through. That's fucking cannot get through. That's fucking.
Some hormones
Yeah.
and certain medications. Okay. I want all that. Autoimmune disorders occur when the body's not...
Sorry. One.
Wait, we didn't throw up a sweet
Alright,
game.
ready?
No.
One. No, man.
So 1, 2. Wait, 1, 2.